Well, thank you, Barry. Good evening, welcome. Thank you for taking the time out and kind of joining us. I know it's a frenetic time, and there's no better time to kind of talk about what we're going to talk about today, which is the cannabinoids and the science and the physiology behind it. As we're going through a viral pandemic, economic uncertainty, there's a systemic issue of anxiety and stress that's really taken effect across not only our country, but really the whole globe. And you can see very astronomical rates of anxiety. And this topic kind of speaks just to that, along with a whole host of other things that we feel are extremely important to drive value, not only to patients, but to the public and regular citizens and anyone who has access to this who's appropriate for it. So a little bit about myself. I am a clinical oncologist. I see patients full-time. I was with MD Anderson for about 10 years. And I'm now with the US Oncology, Texas Oncology Network, opened a new cancer center for them. And my passion comes from treating patients. So my journey into endocannabinoids and the whole endocannabinoid system and kind of learning about it was really over the last 24 to 36 months, where I noticed a huge portion of my patients on these compounds. One way or the other, they were getting them, many of them hesitant to bringing it up to us. And I had to educate myself. I use a lot of pharmaceutical grade medications, including immune therapy and chemotherapy and biotherapy and biologics in the treatments of cancer. And it is very important that we keep a holistic mindset to treating the patient, not just the ailment. So I'm a big believer in using all the science that the pharmaceutical industry and the peer-reviewed journals has given us, and then also extrapolate and utilize plant-based compounds for the patients that need it and value it. And really, when you learn and read upon this system in the body, as well as all the cannabinoids, you're able to begin to understand the amount of clinical research we actually have on these compounds. And it's really at the forefront right now and just starting, and there will be a tremendous amount of research in the next few years as these things are deregulated federally. So, what I'll highlight today is I'll touch on the science of the endocannabinoid system, the cannabinoids themselves, including the endogenous endocannabinoids, some of the pathophysiology, and then how do you talk to people about it? What can you say? What can't you say? What does the data tell us? How do you speak to patients? How do you speak to family members? How do you speak to physicians and healthcare professionals about it? And then we'll touch a little bit on the products themselves. So, let's jump right into the science of it. So what is CBD? Well, cannabinoids come from the cannabis plant. There's over 113 and rising. As we get more and more adept at the technology and extracting these compounds, we learn more and more. So these are plant-based compounds that have real physiologic effects in the human body because they interact with something called the endocannabinoid system. That system is a series of receptors throughout our body, and there is a density of those receptors everywhere in the body. And I'll go through where we see these receptors and why they have the effects we have on our body when it comes to certain ailments that we use cannabis and cannabis-based compounds for. But cannabinoids are a wide array, and the two most common ones that you hear about in the highest volume is THC and CBD. They are 2 of 113 cannabinoids in that plant, and they vary based on strains. And there's a whole host of properties, but some of the things that you will hear me talk about repeatedly is anxiety and stress, sleep, neuropathic and inflammatory pain, seizure disorder, and focus. These are the things that we know these compounds help with. And then there's a whole host of other symptoms and disease processes that are being studied that I do believe will start to show efficacy of these compounds, including Alzheimer's, spasticity-associated Parkinson's, multiple sclerosis, and we'll go and touch on some of these things. Barry, next slide. So what is the endocannabinoid system? This is a real system in the body. These are facts. These are things that, in my opinion, are going to start to be incorporated into the medical curriculum in the coming years. A lot of this has now been developed and found since the early 90s, and we've had a tremendous amount of research from the neurology world. There's neurophysiology, and a lot of this has been mapped out. We have 2 receptors in the body, CB1 and CB2. This is what the endocannabinoids that are naturally made in our body and the plant cannabinoids that we get from the hemp and the cannabis plant interact with. CB1 receptors, there is a density of them in our brain and many of them in our organ systems, and CB2 receptors are in our peripheral immune cells. And they control a whole host of physiologic downstream functions in the human body based on what is activating them. Next slide. So when we talk about what are the compounds that activate and trigger these receptors in our body, think of them as three broad categories. There's endocannabinoids. These are natural in our body. We all have them. And one of them is called anandamide. There's another molecule called 2-TG. Anandamide is very similar to serotonin. It is the blissful hormone. It makes you feel better. It is everywhere in our body. It is like a neurotransmitter. It is broken down very quickly. Everyone's amount and volume of anandamide is varied due to numerous variables and expression of their genes that help make the enzymes that make it, as well as the enzymes that break it down. But the gist is that molecule is naturally binding to the CB1 and CB2 receptors in our body, and that molecule is very similar to serotonin. Phytocannabinoids are what we talk about. This is all the CBD, CBN, the THC that you see in states where cannabis is legal in terms of THC. These are coming purely from the plant. They also work on the same endocannabinoid receptors that our endogenous endocannabinoids work on, CB1 and CB2. And then the last category is synthetic pharmaceutical grade cannabinoids. And a lot of people are surprised to know that we already have them on the market, and they've been on the market well over 10 years. So the pharmaceutical industry does know the value of cannabinoids. They have created a synthetic one called Marinol. Marinol I use in my practice because it is the only pharmaceutical grade cannabis compound I can use. And it works for sleep, and not sleep, it works for appetite and mainly nausea because it is THC based, but it is synthetic. So it is duplicating the THC molecule without all the other aspects of the plant. That's why you will see it work, but it will be splotchy. You could see it work in maybe 4 to 5 out of 10 patients. Compared to medical cannabis, you'll see work in over 90% of your patients if you get the right strain for the right ailment. So when you look at this, look at them as three categories. And there is one last compound that is FDA approved. It is used globally, and it is from GW Pharmaceuticals. GW Pharmaceuticals has the only patent on a pure plant-based CBD THC drug, Sativex and Epidiolex. It is FDA approved for seizure disorder, as well as starting to be approved for pain. These are not synthetic. These are made by the plant, and the FDA has approved it. And there are over 80 peer-reviewed journals and 6,000 patients they've studied over 15 years with GW Pharmaceuticals, which has given us a huge amount of information on CBD and THC and done in a very thoughtful way. A lot of the clinical trials are done like we do them in the cancer world as well as in the medical field. So we have a lot of data on this. Next slide. So when you look at the endocannabinoid system, it's a lock and key. It's a little bit more complex than that because the keys vary. There could be your endogenous endocannabinoids, they could be your plant-based cannabinoids, they could be your synthetic cannabinoids. They all work on the same downstream receptors, CB1 and CB2. Those receptors then in turn control a whole host of physiologic functions. And it is not as easy as you take one compound, you feel this way. What's very unique is there's something called agonist trafficking. That means that whatever binds to those receptors elicits a different door it opens. So the receptor works differently based on what is binding to it. And there are a plethora of these receptors in our brain, and there is a significant amount of them in our central pain areas, our dorsal horns of our spinal cord, which transmit pain, as well as in our tissue and our organs. Next slide. So here's the CB1 and CB2 receptor. CB1 mainly in the brain, all throughout the brain. There are actually more CB1 receptors by density than even dopamine receptors in our brain. So these receptors control a whole host of function, and a lot of them are concentrated in the hippocampus and the amygdala, which I'll show you next, where learned anxiety is done, where there's patterned fears for PTSD is set, and there was a whole host of serotonin receptors in that same area of the brain where the CB1 receptors are. CB2 receptors, peripheral immune system, and immune cells, and some of our peripheral nerves. Next slide. So here's a picture of the brain. CB1 receptors are throughout the brain. Two things to understand from this. That area where they say hippocampus, and there is an area in there called the amygdala. That is where you get a lot of your PTSD, your fears, your learned anxiety. That is where you begin to see why CBD affects mood and anxiety so well, because it affects the serotonin receptors in that specific area of the brain. And not only does it do that, it does a whole host of other things like increasing your endogenous anandamide. It potentiates a serotonin receptor. It works on another set of receptors called the GABA receptor, which is inhibitory and helps you sleep. And we'll go through some of this, but the gist of this is there is not many of these receptors on the brainstem. So the idea that you would overdose from a cannabis-based product is not there. You cannot overdose, unlike opiates, which we have used in a huge volume over the last 20 years. And this has been something that has hit us like an epidemic. And there are over 46 to 50,000 deaths a year from these opiates. And we are now trying to reel all this back because the rest of the world does not utilize opiates like we do here in the US. Same thing with benzodiazepines, which we are using for anxiety. That is all we got for anxiety, and you need a higher and higher dose of it. And it is addicting, and if you cross-react it with alcohol and opiates, it can shut your respiratory drive down. Those are the agents that should be only used for the patients who really need it. Everybody else coming through our door has probably mild anxiety, and we are giving them extremely strong medications with significant side effects without counseling and without having an alternative, such as a plant-based anxiolytic like CBD, which has very little addiction or overdose potential. So next slide. So, this chart kind of gives you an idea of how the different cannabinoids are, and they're in much smaller volume, but as you begin to extract them through technology that we have, from gas chromatography to various extraction techniques, which the biopharmaceutical industry will come into, you begin to see they each have different properties. And when you look at the cannabis plant as a whole and the strain that it produces, that cannabis plant, it has a whole mix of these cannabinoids that all work in harmony together. What we have begun to understand is we are also giving products where you have extracted just CBD. You don't have the other cannabinoids, but the other cannabinoids have varying properties. And as the science progresses in this in the next few years, pharmaceutical industries, equipment and technology comes in, you will begin to see these other isolated cannabinoids used for certain medical conditions. There are even some THC derivatives that lead to weight loss, not weight gain. So you can begin to see how complex this plant is. And as we start to get more and more information, we will be able to integrate this into well thought out clinical trials as this is more deregulated. But this kind of gives you an idea of the amount of cannabinoids there are, and this is only a small portion of them. There's lots of other ones in small varying degrees in the cannabis plant. Next slide. So again, the receptors mainly in the brain, and that's the reason why we get sleep benefit. That's the reason why we're getting anxiety benefit, stress relief. You will begin to see a lot of pain disorders that have a neurologic or a psychiatric component, such as fibromyalgia, irritable bowel syndrome, the spasticity. You treat their anxiety and centrally their pain gets a lot better than someone who just has an inflammatory pain component, because CBD has an anxiolytic component. And by relieving anxiety, you can affect people's pain in a positive way as well. The next slide. So this is a third component of the cannabis plant, which is extremely important. It's something called terpenes that are hydrocarbons that give you the scent of the cannabis plants. But they have been created by the plant over tens of thousands of years for a purpose. And these terpenes are different and unique per strain. If you go to the progressive states where they have medical cannabis, you will see on the back, based on the ailment you're looking for, what is the concentration of these terpenes and the cannabinoids. And the reason they tell you that is each terpene has its own physiologic benefits in the body. Migraine is more for body relaxation. So you can begin to see a strain that's used for pain and sleep may be high in migraine. Limonene is more for energy and focus. Somebody who needs to stay awake in the day and need pain relief may need a strain that has the right CBD to THC ratio, but more predominant in limonene. And you will begin to see now you can extract all these terpenes and add them back and make sophisticated medicinal compounds utilizing these terpenes, the right cannabinoids with the ratios of THC. But this slide kind of gives you a view, and there's more terpenes than this, but it gives you the view of some of these terpenes. And when I talk about the extraction and manufacturing process, you begin to understand how complex it is, because as you go through processing of these compounds to get you that CBD oil, a lot of these terpenes are stripped out of it. And it's not the way it is in the whole plant. You have to be able to give it back to the oil by adding it, or you give a completely isolated CBD, which has its own benefits, but this just kind of goes to explain and show you it's not as clear cut as you take a cannabis plant and you get CBD or THC. So next slide. So, when you talk about a wellness-based product, as I speak to my patients, I see lots of patients, and lots of them cured young women with breast cancer who go back to their normal life. And they've gone through a huge amount of stress going through chemotherapy and treatment. It is almost like PTSD. Many of them I had to give anxiety medicines through their treatments. They're working mothers and people with colon cancer, and many of them are fathers people who have a lot of responsibility at work, and they have anxiety, period. So what do we do for them? Well, we talk to them, we counsel them. But unfortunately, doctors don't have that time. So they reach in the toolbox and we give them Valium or Xanax and Ativan, which helps, and it works to a degree, but it has lots of side effects. I have to be careful of the interactions. I have to wean them off it quick, or they will be addicted and you'll be on it a year later needing a higher and higher dose. And then you probably haven't done that patient much good by keeping them on it that long. Well, this is where you begin to start to see, why not utilize plant-based anxiolytics like CBD in the right group of patients? Somebody has a real psychiatric disorder of anxiety, they need to see their psychiatrist, get on the right medicine. I don't mean this is for every patient who has major depression and schizophrenia. They got to be with their psychiatrist. But the majority of people that are going into their internal medicine doctor, their family practitioner, their oncologist, they're complaining of life stressors. And we're probably giving them extremely strong medications that have a whole host of repercussions because we have nothing better. And we've also been influenced by the pharmaceutical industry, and we don't have much of a comparison against this. Same thing with sleep. What do we do for insomnia? It's an $80 billion industry. The whole country, 6 out of 10 of my patients come to me for insomnia, and they all want something. But the reality is, insomnia shouldn't be treated like that. It needs to have discussion on sleep hygiene. What are you doing before you go to bed? How do you wind down? Teach them techniques, and then cognitive behavioral therapy, then melatonin and valerian root, and then I incorporate CBD with melatonin. And then only do I move on to Ambien, Lunesta, Seroquel, Trazodone. Unfortunately, what we have done is we've reached in for the sleep aids right away. Before you even finish saying the word insomnia, they've got a prescription. But the studies and the clinical trials for those sleep aids are for 3 months to break the sleep cycle. They are not for people to be on Ambien for 2 to 3 to 5 years. The drug company will never stop that because it's an off-label use and it brings in revenue. And there is a role for those sleep aids, but that role is not what we've done. And many countries do not do this. They all have an algorithm where they talk to patients first. Now, some of this is because they don't have the resources to be able to get this, and some of it is because it's the right thing to do. Same thing with seizure disorders. We now know that high-dose CBD is already FDA approved by GW Pharmaceuticals. There's plenty of data on it. The Texas Children's neurologists are using it for pediatric patients. So we know for seizure disorder, it's a very high dose of CBD, nowhere near the doses we're talking about. But there's lots of data with the GW Pharmaceutical data set showing us, and they have lots of data where they're now seeing their data sets of patients they studied it for seizure. They went back and did quality of life surveys, and they're seeing sleep benefit and pain benefit. So it all kind of highlights the same milieu of symptomology that these compounds help with. Concentration, focus, and ADHD, we are thinking that this is starting to become more and more of a potential use for CBD. And I don't mean the extreme cases. They probably need the Ritalin and the Concerta, but there's a whole host of patients and even elderly with polypharmacy and dementia and focus where CBD helps quite significantly with their mentation and their mental health. So these are kind of some of the highlighted things why and how I integrate this. And one thing that's very important is we cannot get in the habit or get ever into the realm of talking to people that CBD-based products cures your cancer, your autoimmune disease, it treats COVID. We don't have any data on that. It may be true. There is a lot of preclinical data, but we can't say any of that until there are clinical trials showing that. All these companies that are announcing this, where you'll see lots of CBD-based products, are getting cease and desist letters from the FDA. And it wouldn't be of value to patients for us to say things that it cures your lupus or your rheumatoid arthritis. It very well may make the medicines that you're on for those diseases make you feel better because it takes away your pain and anxiety, but it does not treat your underlying disease process until we have the data for it. Next slide. So why does it work on stress? Well, it's very interesting. Because of the plethora of serotonin receptors in the brain, it potentiates the serotonin receptor. Zoloft and Paxil are antidepressants that do the same thing. They are SSRIs. They increase serotonin in the synapse, but they have a whole host of side effects. CBD does the same thing. It increases endogenous anandamide, which is a serotonin-like hormone. It potentiates the serotonin receptor. So these are ways and why you're beginning to see this. And I'll tell you, the psychiatry world is studying this. Not only are they studying THC and CBD, they're studying the psychedelic mushrooms and MDMA because they are seeing a tremendous benefit in these portions of the brain. And there is some data on neuroplasticity where you can recreate nerve pathways, and you're starting to see some people cured. But the data will guide us on this. These are not things that I would expect you or anyone else to talk to patients about, but it is important to understand there is absolutely a physiologic change that occurs very similar to antidepressants on why you feel better when you take CBD at the right dosing. And why are we feeling that sedating effect, the effect where the anxiety feels better? Is because the GABA receptor. That is exactly where Valium, Xanax, and Ativan bind to. That is where CBD binds to. It potentiates the GABA receptor. By doing that, you get the same similar effects without all the other negative side effects of the benzodiazepines like Valium and Xanax. Now, there may be a group of people who need those, but it's definitely not the tens of millions of people we've put on them who are coming in for mild stress and anxiety. So next slide. So pain is a big deal. It has afflicted our whole country. We have used opiates like no other. There is no place in the world that is giving opiates like we did for your tooth being pulled, post-surgery. You go to other countries, even Germany, and look at their protocols post-surgery. They do not use opiates. It's just rare anywhere else in the world. And we are now in a system where we have opiates everywhere. And I have a lot of patients on high doses of opiates because they have real cancer pain and they need it. I can't yank them off it and give them CBD. That wouldn't be right, nor does it efficacious at that level of pain. But there is a lot of people with pain associated with anxiety, fibromyalgia, inflammatory mild pain, where CBD has a lot of benefits. And in the progressive states, you'll see CBD and THC compounds, which work synergistically and even better for pain. And some of the ways are, there's an adenosine pathway, there's the TRPV1 pathway. That TRPV1 is in our central dorsal horns in our spinal cord. It's in our central brain pain centers. CBD binds to these receptors via CB1, and it will affect the nociceptive pain that one feels. And this is why we're starting to research this in cannabis-associated pain, because we think this could be an adjunct because it can't overdose you. It's not going to worsen your respiratory depressant. It's not going to work. It's not, and that's the fear when you're treating patients who are on opiates. So it may actually help them wean down if they're looking for an alternative. And once again, I don't mean people who are on numerous pain medicines. That needs to be done through their pain doctor. But that's not most of the people. Most of the people are on mild amounts of pain, and they're on pretty severe drugs that have a lot of potential to have addiction and higher dosing with lots of side effects. So if we're going to do something, we want to intervene in those people early with a plant-based compound that may give them some analgesic relief without getting them to the next level, which is the opiates. And remember, anxiety plays a big role. If you've been in pain chronically, you understand that when the pain kicks in, your anxiety kicks in. And that it's a vicious circle. So CBD not only works on the pain, it works on the anxiety too. Next slide. So, overall, there's lots of health benefits. We cannot make claims that people are curing your cancer or your underlying disease, but we can say there's enough data to say that these compounds work for sleep, for anxiety, for fibromyalgia type of pain, for stress, for seizure disorder. And we don't have better drugs for those. If we did, we would need to compare these head to head, and that will come. Otherwise, we don't have much. We're using off-label sleep aids and benzodiazepines for anxiety. Otherwise, we're going to send them to the psychiatrist. So how do we treat all these other people? Well, this is a good way to start if you find the right group of patients. And to me, I tell you, a lot of my patients fit right into this category. So what I'll go into a little bit now is, next slide. Some of the products, and then how do you get to this? How do you get to these oils from a plant? Because there is a lot of agricultural science and processing technology that comes into play. There are PhD scientists that are working at these cannabis companies in labs that are very sophisticated, like biopharmaceutical industry, using pretty sophisticated techniques to be able to extract out these compounds and get them into the formulation where you can ingest them. So cultivation, hemp is basically less than 0.3% THC. That's probably not the right way to look at it, but unfortunately, that's the way the government has labeled it. So anything less than 0.3% THC is automatically hemp. Anything above it, it's a cannabis plant, and you cannot legally ship CBD products that are above 0.3% THC across state lines. So what we're talking about, Wellness Bioscience, is purely hemp CBD-based products, less than 0.3% THC. And the science to grow these plants is quite sophisticated. They are artisan plants. They can take millions of dollars in facilities to grow this. As easy as you can grow it outside, they take a lot. They almost purify the soil, so they uptake a lot of heavy metals and toxins and pesticides. So it is very important that these plants are tested every step of the way, and we're not ingesting the heavy metals and pesticides and everything else that is there in the soil when these plants are being grown. So once these plants are grown, the buds are cultivated. They're taken off the cannabis or hemp plant, and then they have to go over to a processing type of facility. Next slide. And one thing that is very important is quality and safety matters. If we are talking to patients about it, we as physicians, me and Dr. Patel, would not come near it unless we knew. The herbal industry is a perfect example. There is no regulation. 50% of the turmeric products are filler. You don't have any regulation. The FDA is now coming in after 15 years. They're going to be in a lot faster in the CBD industry, and they are entering with strict regulations. So the companies that are progressive are going to use a GMP FDA certified type facility for extraction. Those are clean rooms. They're going to use ethanol and supercritical CO2 and butane to basically strip the plant material out and get the cannabinoids and terpenes. Now, through this process, as you get to a more pure and purer form through distillation and chromatography, you lose all those terpenes. By the time you get to the end, which is an active pharmaceutical grade ingredient like pure CBD, you're not going to have all those other components to the plant. And those other components have physiologic benefits. It's very different to take a full spectrum product with all the terpenes and just CBD isolate. But there is a role for CBD isolate when you're looking at it from the sleep oil we have. We add the terpene to it in the end because it is a pure product. We know there's nothing else in it. We've all third-party tested it. This is where you are beginning to see all these companies out there. If you go and test them, not all of them have the right quantities of CBD and THC. A lot of them have heavy metals. You would really need, and I would tell you to scrutinize any products patients or anyone uses, because much of it is not what the label says. And it is very important to understand that this takes a lot of capital and sophisticated operating procedures to be able to make these products. And third-party independent lab testing with stringent guidelines is very important, and you should be able to access that any batch, anytime. It is important because you're ingesting these compounds. Next slide. So what are the compounds? What are the products and the SKU we have? And these are always changing. We research these in detail, and as we get more information, we will go back to the processing companies and kind of look at the data and decide what would be of value. Well, the energy oil is a CBD isolate. It has gone through the cultivation and the stringent extraction and refinement process. It is third-party tested. It is tested all the way through by the company as well. It has B1, B2, and you look in the end, that limonene, that's a terpene, that's more for focus. We go back to that terpene slide, it shows you we've added that back in because strains that are heavy in limonene can make you feel more awake and energetic. You're not going to take that in a sleep in oil, but you would take it in an energy form of CBD. And everyone's different. We tell people start low and work your way up. Everyone's underlying body is different, so they react differently to this. Next slide. Sleep oil. Same thing, it's a CBD isolate. It has some melatonin in it, and it works. I use this maybe once in a week if I need it. You put in some tea or you put it under your tongue, gives you good REM sleep. There's no sedation in the morning. It's mild, and I can definitely tell when I've taken it and when I haven't. And I don't need it, I have pretty good sleep hygiene, but it works. And it's very mild and very subtle, which is what you want. You don't want something you need a higher and higher dose of. You don't want something that's going to give you night terrors and you're going to sleepwalk like Ambien. You don't want something where you need a higher and higher dose. You want something very mild, and then you want to use it with sleep hygiene and behavioral therapy, so you may not need to go to pharmaceutical grade medicines. Next slide. So relief balm. These balms, they work. You can put it, you're getting a migraine, rub it on your temple. You will see an analgesic effect and anti-inflammatory effect. Tight muscles, you'll feel it. And I'll tell you, the balms in the States that have the THC, they work great too, because there's a synergistic effect. But I would urge you to try this. The balms do work, and there is a lot of topical benefit. Next slide. The balance pills, these are more full spectrum. They will have more of the terpene profile. The extraction process doesn't go all the way down to the complete isolate. They're great for building up in the system and helping with anxiety and pain relief. They can be taken daily. Next slide. The meter dose inhaler, this is an extremely unique product. I don't think there's any product like this in the country, much less the world. You will see one or two other inhaler-based products, but we're not really sure on the quality. The reason the inhaler is such a big deal is bioavailability and route of administration. When you ingest cannabinoids, CBD, THC, these are fat-based compounds. They do not absorb well at all. That is why you use nanoparticle and emulsification, because we are a water-based body, and to absorb these compounds, you may absorb 15% of what you take, and majority of that is broken down by the liver, because everything that comes from your gut that's absorbed all goes to your liver first. So the amount that's really getting into the blood to hit the receptors in the brain is small from when you ingest it. That's why dosing varies so much for an individual. If you can get this into the alveoli, which are the sacs in the distal parts of the lung, that is where gas exchange occurs. There is no first pass metabolism. It does not go to the liver. It goes straight up to the systemic circulation and to the brain. That is why when you ingest, if you get the right inhaler with the right patented formulation, it has to be between 1 and 4 microns, these particles, to get deep enough into the lung. They will get in the bloodstream and you'll feel it within a minute to 2 minutes. And it allows you a much more efficient utilization of that product. And most importantly, it's safe and the quality's there. We've gone through it with this company who has spent years finalizing this product. The equipment is through an FDA licensed manufacturer called Koster, which makes it for the pharmaceutical industry. The pharmaceutical industry has partnered with this company, and they actually have supplied the equipment to patent the technology to put the CBD isolate into this inhaler. And you need a propellant. A propellant is what pushes this into the lungs, and that propellant is the same one that asthma inhalers use. So we're not adding anything to this but the CBD isolate, which is sourced at a high-level cultivation farm and at an ISO lab-based facility where they are processing this. That means they have GMP type of certification. Even though the FDA is not requiring this, progressive companies will use these standards because they know it's coming. And the inhaler works because of this bioavailability And because it works immediately, people see the difference. And I would encourage you to have people try it. And especially if you have anxiety, it will work for anxiety. If we have pain, predominantly, it will help for the pain. It varies based on what is deficient in the body and what is the formulation that you're taking. Next slide. So, overall, that is a lot of information, but understand that, we're really at the cusp of what's happening. And as this is deregulated, you will see very well done clinical trials in the major universities with these compounds, including THC, and you will then see the pharmaceutical industry move into the space, which is good or bad, but we do need to progress these compounds to a point where we're driving some value to the public, because right now, there's a whole host of issues and ailments that we just don't have good medicines for. And a lot of the medicines that we have extreme amounts of addictive potential, overdose potential, and we've all seen it for the last 10 years. So there is a role for this, and we've just got to continue to educate and discuss this amongst people and physicians and understand, how do we talk to patients about this? And we don't push anyone, we try it. It doesn't work, they don't take it. We move on to the next thing that is in our toolbox. But overall, I've seen significant amounts of benefits with people with this and very little to no side effects. So